want it to record yet.
Oh, yeah.
Oh. Okay, so I'm recording now. I am Carrie Barrington with the Fast Road to Fat Loss. I have Angela Kotzer, who actually is my sister as well, but she is a nurse practitioner. She's also certified in functional medicine. She is a certified personal trainer through NASM and just a wealth of knowledge when it comes to all things hormones, menopause, perimenopause, and all of that. So I am so excited to have her on the call today because this is definitely a super hot topic right now, particularly in the women that I coach. And it's something that I think we all need to learn more about. So, a couple of things that we'll talk about is, what is peri and postmenopause? How does it affect you? A couple of the, common symptoms that we struggle with, what's actually happening to your body, like the science of what is going on, and then how to navigate those symptoms and then take back control. And then also she'll share a couple of lifestyle tricks to help us feel empowered rather than, suffering like we're the victim. And then obviously I've got questions. I know there'll definitely be some questions. So with that, Angela, take it away.
Yay. Thanks. First of all, thanks for having me. I'm super
Absolutely.
excited about this, especially to talk to a group of people that's already making changes for themselves, and aware that, they can change their lifestyle and it's going to impact their health. So I love this and I'm grateful to be here. So thank you. So I guess first and foremost, I think that the problem with, well, first of all, I'm in perimenopause. So that's kind of where my passion started is I wanted to figure out what in the hell was going on because probably like many of you, nobody talked about this. I mean, I'm going to throw my mom under the bus here, but we never had this conversation. Honestly, we never even had the conversation about having a period. She handed me a pamphlet and walked out of the room. So we're going to just preface that that's how I learned about hormones. So I was felt really unprepared. And I didn't really understand what was happening, not only to my body, but to my mind. I felt like I couldn't remember anything. Body composition changes, there's all these symptoms, but again, nobody was talking about it or teaching me what was happening. So that's really what got me into learning more about hormones. As Carrie said, I'm a functional medicine nurse practitioner. So really what that means is rather than treating symptoms, my goal is to really treat the cause of what's going on with somebody. And so, yes, a lot of my patients happen to be women who just didn't feel right, but they would go to the doctor and say, here's my list of complaints. They'd get labs run, and then they're told, oh, you're fine. Everything's normal or within normal limits, but they just didn't feel fine. They're gaining weight. They're losing muscle, they're having a low libido, they're just tired, they hurt everywhere. So anyways, the goal of functional medicine is to do that, to dig deeper, figure out what's underlying the issue. And so when it comes to this stage of life, where so many things are happening, the problem also is that everybody's different. So, whereas one person may not have any symptoms, somebody else can feel absolutely terrible and paralyzed. And so it's really my goal now is to help women really feel like they can take control of their symptoms and get back to feeling like themselves. And so that's what I hope to accomplish tonight is to really help you understand a little bit more about what's maybe going on with your body and what are a few simple things that you can do right now to take that control back. So you, like Carrie said, you don't feel like a victim. You're not letting this whole thing take over. So before we get too in the woods or deep into this, let's talk definitions. So perimenopause, that is the time leading up to menopause. So it can be like 10 years before you actually stop having periods. So it's a long time of wondering what the hell is happening. Menopause is the one day after you have not had a period for an entire year. So it's one day. Postmenopause is everything after that. So honestly, the reason this is so important is an understanding is because we spend 30 to 40% of our life in that after part. So we want to make sure that we are living optimally well, right? We want to be able to like grasp hold of our life and control it because that's the time, I mean, our kids are growing up. We don't have to literally spend all of our waking moments pouring into taking care of somebody else. Maybe we have parents now we're taking care of or whatever, but this is a time of life where we can start really digging into our career if that's what we want to do, or we can start traveling and we want to do that with vitality. So, anyways, perimenopause, before menopause, one day, postmenopause, everything else. So, what's happening? How do we like get to this point? So, perimenopause is kind of this gradual transition. And during that time, all of our hormones are lowering, but they're lowering at different rates, which is the problem. So, typically, what happens is, you have your period, and then estrogen will spike around, I don't know, it starts to spike around day 7 for a little bit, and then it triggers basically this whole FSH and LH things. Basically, it's going to trigger ovulation. So we ovulate around day 14. Normally, what happens is after ovulation, we start to have progesterone increase. And progesterone is kind of this calming hormone. It helps with sleep and lessens anxiety and things like that. If we don't ovulate, which is what starts to happen in perimenopause, you may not ovulate every month. You might ovulate once every 4 months or whatever. So if you don't ovulate, you're not going to get that progesterone pump or that production of progesterone. So then what happens is that now you have this imbalance of your estrogen and progesterone. Estrogen tends to cause some anxiety. So have you ever woken up in the middle of the night at 2 a.m. panicking, trying to solve all the world's problems, and you have no idea what's going on? You're like, oh my God, what is happening? That's anxiety. Okay. That is the estrogen in your body not being balanced. So perimenopause, oftentimes we see something called estrogen dominance. It's where that estrogen is kind of being that louder speaking hormone, and it may cause headaches or breast tenderness, breast enlargement. Like I said, the insomnia, the increased anxiety, things like that. And it doesn't necessarily mean that your estrogen is high. It just means that it's out of balance with progesterone. So that's kind of what's happening in perimenopause. And in general, like I said, it can be 10 years up to it, but the 3 to 4 years right before menopause, things are definitely getting worse. We're going to see problems with body composition changes. That belly fat kind of around the middle starts to happen. So as the ovaries stop releasing hormones, our adrenal glands decide they need to pick up the slack. You guys have heard of cortisol? Yes. So cortisol is that nice stress hormone. So this is a problem because now we have this increased stress. Well, this happens to coincide with a busy time of life anyways. Well, at least it has been known to, whether it's career things or family things. Like I said, kind of in that sandwich gap with kids, you're still trying to help, and parents, you're trying to help. So we've got all this other stuff happening, as well as the hormone shift. And so that cortisol tends to cause increased problems with the belly fat, but also we're developing something called insulin resistance. So probably you guys have heard of that topic, especially if you're in faster way. Insulin resistance, kind of where, we're just not able to use our carbs as well. And so if we have insulin resistance, we're going to end up gaining more weight too, which becomes a problem. And also that can lead to other issues like increased anxiety and hot flashes and all of that, which just adds to the other problems that we're already having with all the other hormones. So that's kind of the gist of that. What else happening behind the scenes? Our goal is we really want balance. Again, we want balance with our hormones, but it's not just about like one little thing, it's about everything. So balance in our life, whether that's, making sure we get plenty of sleep. That's huge when it comes to controlling hormones. Nutrition, absolutely, definitely. I mean, I know I don't have to preach that to you guys, but it is uber, uber important right now to kind of tighten the reins. And we'll get into details about that. I'm sure you have questions about that. But it's the sleep, the nutrition, exercise. One of the things that I like to remind people is that exercise can actually help with just about every single symptom, except for maybe vaginal dryness, when it comes to menopausal change. It's not going to completely fix everything. I mean, if we talk about, the common symptoms, the ones everybody hears about, hot flashes, night sweats, and they're not awesome. They're terrible, as a matter of fact. Very disruptive. Insomnia, whether it's from the hot flashes or from the anxiety or just can't sleep, it's a real thing, big problem. Low libido, um, which, I've heard, I can't tell you how many women they're just like, they don't even care anymore, which isn't, I mean, that's not good, especially if you're in a relationship, like that's an important piece. The vaginal dryness, there's urinary symptoms, so maybe you're having more incontinence. Heart palpitations. I've had countless women coming in thinking they're having like some crazy problem with their heart, and it's just their hormones causing the problem. Um, it could be anything. Well, my favorite, hair loss. Of course, you lose it on your head and it shows up on your face, which is awesome. I need a way better mirror than the one I have because or maybe it's the lighting because I'm missing them. It's terrible. I just ordered a new tweezerman to leave in my car so that I can pluck my eyebrows when I'm driving after I get to work and the sun's shining and I'm like, there they are. Oh my gosh. So eyebrows, chin hair, it's awesome. Okay. Anyways, memory or cognition. This is a huge, huge problem.
Yep.
Yeah. So if I say something wrong tonight or forget something, this is why. It's just my hormones. You have to excuse me. Skin changes, so of course, wrinkles, cellulite, thinning of skin, all of that are all going to be hormonal symptoms. But I mean, we could probably go on and on. And everybody's going to have kind of a different assortment of them. One that I often don't think people contribute to hormone loss is actually joint pain and not recovering from exercise. So this is actually a time where in your life you really do want to pay attention to that recovery time and really honor your body because it is going through a lot. You're going to be more prone to inflammation. I probably see more shoulder, like frozen shoulder, plantar fasciitis, tendonitis of any kind during this time in females too. So that's why mobility is going to be super important when you're working on with your training and stuff. Yeah. So that's kind of like the background on what like perimenopause, menopause, all of that is and symptoms. So I started to mention like there's things that we can do to control those symptoms. Exercise is probably, let's maybe start there if that I'm sure that seems to be like a good place for this group anyways. And I love the Faster Way program because it is actually, whether you know this or not, it is definitely science backed. It's following the research for women and how we should train, especially during these years of our life. So it's really emphasizing strength. And so, physiologically in our body, as we've lost, we're losing our estrogen. Okay, so let's say you're menopausal, you have no estrogen left. Although you may have some, I guess don't get me wrong, your body will still produce some, especially if you have extra fat storage, you're going to actually probably have a higher estrogen. You may not even have symptoms of hot flashes or anything because of that. And that's wonderful for you. But anyways, as we're losing our estrogen, we're actually losing the stimulus that we need in our brain to build muscle. So let me say that again. When we're before age 30, we can exercise any way we want. It doesn't matter. Does not matter. We're still going to get a really good response in our body. Our body's going to change awesome. But once we get past that 30 into the 40s, and definitely those years before menopause, when our estrogen is down, we don't get that same stimulus in our central nervous system to build muscle and maintain muscle. So unless we are actively doing something to build muscle, we're losing it. Every single decade after age 30, you're losing 3% of your muscle mass and your bone, actually. So, which becomes very much a problem.
Yes.
Bone loss will accelerate once you get to age 60. So, strength training and high intensity interval training happen to become that stimulus if you do it right. So that's what we need to do is we have to figure out a different stimulus since we don't have estrogen now. So that's where the strength training comes in. If you're new to strength training, which I'm assuming a lot of you guys are not, you've been doing Faster Way for a while and not a novice. That's awesome. really make sure you're taking advantage of lifting heavy. That's what we need. We do not need to be doing 20 reps of 2 pound bicep curls. That is not going to help you.
Mom. Yep. Sorry.
No, that's so true. I mean, I know there's like some fear around it. And honestly, if I could tell my younger self this,
Yeah.
ah, how much better would my life have been if I would have done strength training? I mean, I didn't get introduced to it till like maybe 10 years ago, which is unfortunate because I just was a cardio junkie.
Yep.
And yeah, so exactly. Yes.
Have you
Yes.
met?
So well, we now know, and it's never too late, right? We now know.
Yep.
So strength training is really, really important, and it's about the lifting heavy, less reps. Obviously, Faster Way is really good about structuring programs. So if you're doing that, it's just making sure you're challenging yourself. Because if you're not challenging yourself, then you're basically just going through the motions, and you may not be getting the results that you want. Yeah.
Yes. I'm glad you said that because there are a lot of people that just go through the motions and it's just, they're just doing the workout, but they're not actually like really thinking about what they're doing.
Yeah.
Exactly. Just going through the motions and
Mhm.
they're frustrated with their results. And it's like, well,
Right.
you have to do more. You have to lift heavier if you want to make that change. But
Exactly.
you got
Yeah.
to push yourself a
I
little bit
mean,
more every day.
right. You know, I follow Stacy Sims quite a lot. I took a couple of courses from her, and one of the times I listened to her, we were talking, or she was talking about how, how do you pick your weight? And I was like, oh, that's such a good question because a lot of us can't do like our 1 rep max or whatever, don't have the capability to figure that out. But she said, really, if you are lifting a weight and you can do 8 reps,
Mm-hmm.
but you still have 2 in the tank. So you could do 10, but if you did that 10th one, that would have been it. You'd have been wiped out. Like that's the weight you're going to lift if you're doing 8 reps.
Yep. I
So yeah.
think I heard that some
Um,
podcast.
did you? Awesome.
I listened to it
Yeah,
last
she's
week and that really hit home for me. And I was like, okay, yep. So
yeah.
immediately I was like, all right, I'm picking up the heavier weights.
Mhm. Yeah. Yeah, so that's awesome. Like that's how you're gonna make that switch. And strength training is super important for, I mean, not just building muscle, but when we're talking about this insulin resistance problem. So if you've ever been told you have insulin resistance or PCOS, or and maybe you've never been tested, which is the other problem. But if your glucose is high, even if it's above 95, I would say you probably have an issue and should start thinking about this. But strength training helps to make those cells sensitive again, which is what we want. So really, really, really important. Um, okay, so the other aspect of when we're thinking about, how do we recreate that same stimulus in the brain? That is your interval training. So high intensity interval training, sprint training, that is the master. Of course, again, you don't want to overdo it. So 1 to 2 times a week, which is the program, which is awesome. And listen to your body. So this is where, perimenopause, menopausal, if you're super inflamed after your HIIT workout on Monday, then maybe you want to don't do Tuesday's HIIT workout. Maybe you need to change up your schedule a little bit because you want to pay attention on, like I said, honor that inflammation. How's your body responding? But 2 days of high intensity interval training is awesome. That often is going to include jump training too. So when we're talking about menopause, one of the big problems with menopause is that we're losing bone. So that's that whole osteopenia, osteoporosis. One of the best ways to rebuild bone is to jump. That impact is huge for that. It's oftentimes better than medication, but women are afraid to do it because we think we're too frail or whatever. But we need that impact from jumping safely to help build our skeletal bone or hip bone or whatever. Even for upper body bone, let's say you're at the age you've had a bone density scan and you know that you have weaker bones in the upper part of your body, doing some type of jump type of training like plyometric push-ups or something will help build that bone structure versus like jumping rope or jump squats is going to build like the lower body and the spine. So anyways, the high intensity interval training is going to help with that. High intensity interval training is going to tap into your fat stores.
Right.
It speeds up how we metabolize our fat or use the fat in our body, which I think is probably a goal for most of us, is being able to burn that fat a little more efficiently. So yes, like all of those things are important.
So
For
long form cardio, no.
probably not. No, unfortunately, that's going to build up your cortisol, which we already have a problem with, right? We just talked about how your adrenals are already overstressed. So this
Yep.
is what happens. We hit whatever, 45, we start to gain some weight. So we decide we better not eat as much, right? And then we drink a bunch of coffee
Yep.
because we're now trying to like
Well, that's
mitigate. Yeah.
I still drink a lot of coffee, but
So now we are putting extra stress on our body because we're
yep,
starving and we are now flooding our body with adrenaline unnaturally.
yep,
So there's this whole cycle that begins to happen. So now we're our metabolism is slowing down because we're not eating as much. And so we know we may lose weight for like a week or two, and then it's going to come back with a vengeance, which becomes, I think, it's like this vicious, like I said, vicious cycle. So really, really important that you don't do that.
yep.
And actually that brings me to like the third stimulus that you really, really, really need to pay attention to is protein.
Okay.
Sure, you've talked about that before, Carrie, a time or two.
Talk about that a lot. Yep.
Yes.
Super
Yeah.
important. That is the
Mm-hmm.
one macro. I know a lot of people don't like to track macros. People not
Mm-hmm.
in the faster way. And some people
Yeah.
in the faster way don't like tracking, and that's fine. But I do tell people if you're gonna track anything, track your protein. Like that is the
Mm-hmm.
main that is the main thing.
Mm-hmm.
Practice tracking that so then you can get to the other stuff, but that's so important. And as women, we undereat. I mean, I used
Oh
to
yeah.
eat, I mean, now I eat like 140 grams a day, but there was a time where
Mhm.
I was barely getting like 60 grams a day. I was
Exactly.
like,
Yeah.
how was I maintaining any muscle mass? Like,
Mm-hmm. Yeah.
I don't know.
Yeah, it's a big problem. That's what countless, I mean, I don't know how many patients I see a week, but it is probably 80 to 90% of the patients I see are eating anywhere from probably 60 to 80 grams of protein. And they're like, I ask them, are you eating good protein? Oh yeah, I'm eating a ton of protein. And then we actually get into it. I'm like, oh my gosh, you're not eating a ton of protein.
You're not.
We have work to do here.
Yes.
So yeah, and the problem with it in this stage of life again is that we are not only becoming insulin resistant, but we can become or we become both protein resistant and insulin resistant.
Oh,
So meaning it's going to take more protein ingested to be able to get used in the body. If you think about it, your body is made up of everything is made up of amino acids. Everything from your DNA to your hormone cells, to your skin cells, to your muscles. So all of the tissue in your body, your hair on your head, it's all based on amino acids. So
yes.
if we're not putting them in, guess what's happening? Your body needs them. So it's going to break it down from somewhere else,
Oh,
meaning your bicep
yes.
or your quadricep or something like that,
Yep.
which we don't want.
Right.
We just
Especially
work
as
really
we're
hard for
losing
that.
muscle every year.
Yeah,
Right.
exactly.
Yes.
Yeah. So it's going to be super, super important to really focus in on hitting that macro goal for sure.
Okay. We have 7.5 minutes. So,
Okay. So what questions maybe do you have that I've not covered?
well, that was a lot of information quickly. And you did kind of cover most of it. I guess one question I have is what are your favorite supplements? What supplements do you recommend that
Yeah.
women
Well,
in this stage of life should take every day?
right. Yeah. Honestly, it depends on the person in terms of like what they have going on in their body. So,
Right.
um, Omega-3s, I always like if you don't eat fish, especially, but if you are a good fish eater, eating fish like twice a week, you're probably getting your omega-3s, also flax, chia, walnuts, things like that.
Okay.
But omega-3s are going to reduce inflammation in the body. They have been shown to help improve hot flashes too. So
Okay.
obviously it's going to help support cardiovascular, which I didn't even hint on, but really this is an important time as once we lose estrogen, we are more at risk for cardiovascular disease. You may start seeing your cholesterol rise, other problems start to happen. So anyways, omega-3s for sure.
Okay.
If you've never had your vitamin D tested, you should. Vitamin D, again, is going to help with inflammation, but it's also important for blood sugar and insulin.
Okay.
That's one of those supplements you don't want to just like overdo. It's a fat soluble supplement, so it can build up and become toxic. So that's why I say if you've never got it checked, probably worth checking to make sure either if you're already on a dose that you're on the right dose, or find out if you need to be on some.
Okay.
Um, Also, that's going to help with bone health. So vitamin D, K2 help pull the calcium and vitamin D into the bone to help protect our bones. It's anti-inflammatory, it's immune system, a lot of stuff.
Okay.
B vitamins.
Yep.
We do get B vitamins from our food. So if you're eating a good amount of animal protein, a lot of leafy greens, things like that, you're probably getting a good amount of B vitamins. But there's a lot of times where, I mean, I do genetic testing on people too. So some of us don't actually assimilate B vitamins very well. Some of us have more of a need. But the main thing I think about when I think about B vitamins is it's going to support detoxification. So, which becomes a problem. If
Right.
any of you have been able to drink wine and then you hit 45 and you can't drink it anymore, this is why. So anyways, detox, migraines, really metabolizing hormones better, supporting sleep, things like that. So B vitamins, energy, metabolism, all that. I like magnesium too, just because it helps with things like headaches, constipation, blood pressure, sleep, anxiety, recovery from exercise. When it comes to things like anxiety, I also think about some adaptogens and herbs. So lemon balm is
Oh,
a really good one. It's also what I call the happy herb. So it's calms anxiety, it helps with depression, but it's also helpful for hot flashes. And it's pretty mild. Like I don't really think there's many drug interactions with that, which whenever you take any kind of herbal supplement, you do want to kind of make sure you're paying attention to that if you're on medications. The other one I like is L-theanine for
okay.
anxiety and sleep. Really, really good. Then there's a couple other a couple other adaptogens, but again, it really depends. So if you have a provider that you see, that would be awesome. They can kind of guide you on this. But ashwagandha is a favorite. It's definitely on the calmer side. And then rhodiola, if you're really tired, it's more of an energy side thing. So adaptogen, what that word means is it's basically helping your body adapt to the stressors. And again, we just talked about how much stress our body is under during this time. So they can be pretty supportive, can help with supporting your hot flash symptoms, fatigue, body composition, even for some of them. So that's kind of like, I mean, there's tons of supplements, not a lot of research on a lot of things, but those are at least some core ones that can be helpful or things to think about for sure.
What do you think about creatine?
Love it. I don't even know why I didn't mention that. I think
I
that
thought
every
that would
female
for
should be
sure
on
be one
it.
of your top, but
Yeah.
yes,
I don't,
and I love
it's,
all the other ones you said, but yeah, that was one that I have been taking for a while and have really liked it lately. So
yeah, absolutely. And that one dosing is, I mean, if you're sensitive, you could always start with like one, like it's 3 to 5
yeah,
is the dose, but you could always start with one and just work up and see how you tolerate it. But for the most part, creatine monohydrate is pretty benign. Like I don't think many people react to it. So definitely can help with recovery, with building strength, brain health.
okay.
Yeah. Mhm.
So, Dee, do you have any questions?
Gosh, I can't think of anything. I was actually curious on Angela's opinion on the creatine. I've been taking it for a couple of years. So I'm glad to hear that she
Yes.
liked that too. So,
Yep.
so that's great.
Yeah.
And I can tell a difference, I think, the past, of course, you have to be consistent with it.
Mhm.
And I was kind of here and there and all over the place. And I probably, I don't know, 6 months ago, I made it a point to make sure I was taking it daily. And I think I can definitely tell in my recovery,
Awesome.
um, how well
Mhm.
it's working. I think everything finally that I'm doing maybe is just kind of all
Starting to.
working together with my
Awesome.
crazy brain. It's not so crazy anymore. So, um, but yeah, I really can't. Oh, I did have a question on, so recently, and I'm postmenopausal. So recently I've been having what I'm calling cold flashes. Is that a thing?
Yeah, it
Oh my
definitely can
gosh,
be a thing.
which is
It's
so,
just
it's
a regulation
weird.
of, yeah, it's just your body temperature regulation system is off.
Yeah.
So,
Okay.
yeah, it is.
After being hot for so long, I kind of welcome it, but it's the strangest thing.
Uh,
It doesn't make any sense. So I was just curious about that.
We have like maybe 30 seconds left. So, any final words?
no, really, thanks so much for having me. If
Yeah.
anybody is local, come see me sometime. I work
Yeah.
at Advent Health, the Whole Health Institute. Would love to see you.
Reach out to me and I'll send you her info and send it so you can see her. She's in Leawood, Kansas, or Overland Park, Kansas.
Yeah.
Yeah. All right.
Yeah.
Thanks, guys. Have a good night, and we'll have to do this again.
Thank you.
Thanks, Ange.
Yeah.
Bye, Dee.
Thanks. See ya.
Bye.